Good evening, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD. Um, this is a webinar where you get to ask me any questions you want about Lyme disease, and I'll try to answer them to the best of my ability. Hopefully, working together, we can find some ways to improve your treatment. Keep in mind, questions you ask may be of interest to other people too. There's a lot of learning that can take place from the questions that get posted here. So the way that you create this webinar is with your questions. And to do that, over here on the bottom of the right-hand side of the screen is a chat box. Go ahead and write your question in there. Do not hit the enter key until you're done writing the whole question, though, because each time you hit the enter key, it sends a separate question to me. And if it gets broken into too many pieces, it's hard for me to follow from my end, okay? During the webinar, I'm going to be showing your questions on the screen. And I'll be reading them, though, in case people have a hard time, especially in the recorded version, being able to read the whole question. So I will read those questions. Tomorrow morning, probably around 6 or 6:30 Seattle time, I will send you an email with a link to the recording of the webinar tonight. So yes, this is being recorded. So if you happen to not get enough of the information or you need to hear it again, just realize that you will be able to hear that recording again tomorrow. If for some reason you do not get the email from me, just at the website, www.treatlyme.net, which is the site of the Treat Lyme book. That's where you went to sign up for the webinar. There is a webinars recording page that you can go and find because I'll post it on the website. Okay. In fact, the link that I send you in your email is actually a link to the website recording page. So that should be by around 6 to 6:30 a.m. Seattle time tomorrow. Okay. This is the first of 3 webinars that I hope to do in a row, as long as my voice holds up and as long as you keep showing up and asking questions. So there'll be one tonight, next week, and the week after that, and then I'll take another break. So usually I try to do these about 3 in a row. I just want to let you know that tonight you may hear me coughing or sneezing a little bit. I've got my seasonal allergies have kicked up a little bit, so just I apologize for that in advance. So without any further ado, I'm going to go ahead and get started here. And I'm going to post the first question. So this is a question from Kit. Hello, Kit. Let's see. My regular doctor said I have subclinical hypothyroidism. Is it okay to start Nature-Throid half grain while on Sida acuta? My thyroid hormones are on the low side of the normal range, but I have a lot of fatigue. Thank you. Okay. So to answer your question, yes, you can take Armour Thyroid with Sida acuta. Okay. Now I want to explain more so everyone else knows what we're doing here. So Sida acuta is an herb that Kit is using to treat her Bartonella. And it is one of 2 herbs that I recommend to treat Bartonella. I usually like to mix it with another herb called Sida acuta. Those 2 herbs tend to work about 70-75% of the time. That compares with prescription antibiotic combinations for Bartonella that work about 80 to 85% of the time. There is an article I have about how to treat Bartonella if you are looking for the ideas that I have. It's called How Kills Bartonella, a Brief Antibiotic Guide. I'll show it to you in a minute where you can find it on my Treat Lyme book website. Okay? All right. So Nature-Throid is a form of thyroid that is actually ground up thyroid gland. All right. And it comes to us from pork. It is made, because it's ground up thyroid gland, it has the same kind of thyroid that is comparable to what our own thyroid gland makes. All right. So our thyroid makes 2 kinds of thyroid hormone. One is called T4 thyroid. The other is called T3 thyroid. The difference between T4 and T3, there's 2. Number 1, T3 has 3 iodine particles on it. T4 has 4 iodine particles on it. So we identify them by how many iodine particles they have on them. Also, both T4 and T3 get moved into your bloodstream from the thyroid. They go out to the cells. And then inside the cells, the active form of thyroid is actually T3. So all of that T4 has got to be converted into T3. Okay, so what our cells actually use is T3 thyroid. Most doctors don't treat Lyme, do not prescribe Nature-Throid. They prescribe something called Synthroid, which is also called levothyroxine, which is T4. Our thyroid glands predominantly make T4 with a little bit of T3. I find when I give thyroid that I like to use a Nature-Throid or Armour Thyroid, that they're both ground up thyroid glands. And the reason I like to use it is I think it more closely mimics what our own thyroid makes. Secondly, I think they're more bioactive. I just find a better response in my patients when they use it, okay? Now, traditional doctors still tend to use more Synthroid or the synthetic. And the reason is that that synthetic thyroid per pill is always equal. So 50 micrograms of levothyroxine Synthroid is always 50 micrograms of levothyroxine Synthroid, okay? It's always the same amount. You can do very precise dosing of the active ingredients when it's synthetically made. Armour thyroid and nature thyroid, which are both desiccated thyroids on the other hand, are ground up thyroid gland. And so there's going to be a little bit of imprecision in the amount of actual T4 and T3 per pill. There's a little variation. And therefore, most doctors, the conventional viewpoint is not to use it. However, it doesn't really matter because that thyroid that you take, that one pill, is actually affecting how your cells work, the metabolism, the rate at which the cells run for about 3 weeks, all right? So it's long acting. And therefore, since its average impact is 3 weeks, if there happens to be a little variation in strength from one pill one day to a little bit different the other day, it doesn't matter. It all averages out. So it doesn't really matter. So my preferred way still is to use the desiccated nature thyroid or desiccated Armour thyroid, okay? Now, one other issue that Kit raises here is using thyroid medicine when you have normal thyroid studies. I do it that way, but I can tell you that medical boards consider it controversial. In fact, my medical board has questioned me about that practice as well, too, and I'm having to explain to them why it is that I work that way. But it is a practice of many integrative medicine doctors and natural medicine doctors that we will give thyroid based on your symptoms as long as the labs say that we have room to increase, okay? So when we look at thyroid, when we measure the thyroid chemicals like your T4 and your T3, the lab reports it in a range. And that range has a range of normals. So for instance, T4, free T4 can have a range, normal would be 0.8 to about 1.6, depending on the lab. So if somebody gets a T4 back and it's 1.1, and the normal range is 0.8 to 1.6, well, guess what? We have room that we can go up on it, okay? All right? So the way that I figure out and talking to my patients about thyroid to try to decide if I might want to give them more thyroid to help them clinically and to help their immune system work better, to help them feel better, is I ask them questions, trying to figure out if their thyroid is low. And one of the questions I think that is most helpful is to ask a person if they have a lot of cold intolerance of their core body, core being your chest and your abdomen, not your hands, okay, but your core body. And so one way to figure out if you have cold intolerance is if you're that person that has to wear more layers than everyone else in a room to stay comfortable, whether it's an air-conditioned room or whether it's a heated room, if you are the person that's having to wear more layers than everyone to stay comfortable, then you probably have low thyroid. I have found to have clinical correlation. And I find that I give enough thyroid to be able to get a person so they're not having cold intolerance. That is helpful in terms of their overall Lyme outcome. Okay. Now, other symptoms that make you think of low thyroid are, cold intolerance, as I just said, dry skin, having low energy, but Lyme can give low energy for other reasons as well, too. And in women having changing periods, for instance, sometimes, and then also weight gain can sometimes be symptoms I'll consider if I'm trying to decide if somebody has clinical low thyroid, okay? So the term subclinical low thyroid is kind of a misnomer. It's a person that has clinical low thyroid is how I would wind up using it, is if their clinical symptoms said it. Now, if the only thing I'm seeing is a person has low energy, but they don't have cold intolerance, I tend not to give thyroid in those situations, all right, if their thyroid testing is in normal range, okay? All right. So I just wanted to explain all aspects of that. Now, I did say I would share with you my screen so I can show you the article that I have written about how to treat Bartonella. At treatlyme.net. Many of you know this is where you have first learned about the webinars. This is where I've published all the resources that I have about how to manage Lyme disease. And so if you're looking at how Marty Ross recommends to treat things, take a look here. I'm going into the chapter that's called Infection Treatment Plans. Okay, so this is the Chapters tab. You would click on the Infection Treatment Plans. And in terms of the ideas that I have for treating Bartonella that I have found successful, here's the article called Kills Bartonella, a Brief Guide, where I lay out both herbal and prescription options for you. Okay? All right, let me go back here. All right, Kit, thank you for that question. And I hope that gave you some good answers too. All right. Hello, Colleen. Let's see. Hi, Dr. Ross. Can I eat foods which contain pre and probiotics at the same time as my dose of herbs, or will the probiotics inactivate the herbs? I don't care if the herbs inactivate the probiotics. I'm not eating the foods intentionally for the probiotic effect. Okay, so the issue, Colleen, thanks for that question. So the issue with probiotics and herbal antibiotics or any antibiotics is that you worry that the antibiotics, herbal or prescription, can kill your probiotics if you take them at the same time. There is not a reverse effect, though, where the probiotics make an herb not work correctly. Okay, so to answer your question, you'd be okay taking them together. Anyhow, there you go. All right. Thanks for that question, Colleen. Hello, Norlana. Let's see. Question for today is my brother. He got bitten by a tick in Germany. He got a red rash local that kept increasing. The size, he got a red rash local that kept increasing the size as a few days passed. It's not the bullseye rash. Should he take antibiotics for 30 days or 21 days doxycycline? All right. So when we're considering whether to give somebody antibiotics after a tick bite, there's a few things to consider. One is, are you in an area where there's lots of Lyme? Okay, so Germany, various areas in Germany, and I don't know from what you're telling me, but I know the Black Forest area, and also a lot of Germany is just full of Lyme. Germany happens to have quite a bit of Lyme. So there is a risk he could have gotten it, okay? The other thing you consider is, was the tick actually attached? And when you say bitten by a tick, that means the tick must have been attached. Okay. Now, the infectious disease doctors will all tell us it has to be attached for 36 hours. All right. But I think that's garbage. I think it's very sad that they say that, because I have seen people get Lyme from brief tick attachments. And in fact, it can happen from brief tick attachments. Okay. So in Germany with a tick bite, he's got risk of getting Lyme. All right. So what I do in situations like that, I like to use anywhere from 3 to 4 weeks of antibiotics. I prefer 4 weeks. If we look at the research, even by the infectious disease doctors, where they all recommend 3 weeks of antibiotics, 3 to 4 weeks of antibiotics will get rid of Lyme symptoms and prevent Lyme from becoming chronic about 90% of the time. So even the infectious disease doctors who say you only use 1 month of antibiotics, you don't use any more, even their data says that 10% of people still go on and have chronic problems, okay? So treat for a minimum of a month. I would use doxycycline, and I would take it as a 100 milligram pill, 2 pills, 2 times a day. They're going to probably try to give it as 1 pill twice a day, but you have better effect at 2 pills, 2 times a day. And the reason you pick doxycycline is it treats Lyme, and also can pick up other germs transmitted by that tick bite too. So it can pick up Ehrlichia, Anaplasma. In an acute setting, it helps prevent Bartonella from setting up and prevents Babesia from setting up too. So doxycycline is picked as our drug of choice in an acute tick bite situation because it treats a whole host of potential tick infections that you get along with Lyme, okay? So, and then the rash, just so you know, rashes for that you get with Lyme, the most classic one is the bullseye rash. but not all ticks give you a bullseye rash. They can give you other rashes too. Now, that kind of rash you described is not necessarily specific for Lyme, but still a substantial rash. I mean, I just want to note that that happened, but without being a bullseye, that doesn't diagnose Lyme, all right? But I would do probably 4 weeks, a minimum of 3 weeks. And once the antibiotics are stopped, within a few weeks, if there are any symptoms coming that look like Lyme, I would go back on at least 1 to 2 more months of antibiotics. That's how I usually would handle it, okay? All right. Oh, and then your brother should be on probiotics as well, too, okay? All right. Good luck to your brother. Thanks for that question, Orlando. Hello, Charlie C. What I have since the neurologist said of the damage I have is the nerve endings themselves and not the membrane. What is that? Charlie, I'm wondering if there was another part to your question that I'm just not seeing here. Hold on a minute. Huh. Charlie, unfortunately, I'm not seeing the rest of your question, so I'm not sure how to answer that. If your question was something about neuropathy and whether you can repair it, whether it's the whole nerve that's damaged or the nerve membrane, the recommendations that I have about repairing neuropathy work whether it's just damage to the nerve, a membrane, or whether it's damage to the whole nerve itself. Okay. And so those recommendations involve fixing the membrane covering, which also fixes the energy factories in our cells called mitochondria. So every one of our cells has an energy system called mitochondria. There's 300 to 400 mitochondria per cell. In our nerves, especially, we need that kind of energy to heal damaged nerves. And also, when you have chronic infection, the membrane that makes up the covering of the mitochondria, which is a double layer of fat, can get injured. Also, in neuropathy, nerve membranes can get injured. The same fats that make up the covering of your mitochondria make up your nerve membranes. And so there is a supplement called NT factor that's made up of the kind of fats that can help repair mitochondria membrane and nerve cell membrane coverings. I usually tell people to take NT factor energy, 2 pills, 3 times a day for 2 months, then decrease it down to 1 pill 3 times a day, okay? The other thing you want to do with nerve injury and also mitochondria injury is to take coenzyme Q10, 400 milligrams twice a day. And then I also would be on glutathione, which is a very powerful antioxidant made in every one of our cells that helps repair cell damage, including nerve cell damage, any kind of cell damage. It's also used by the liver for detoxing as well, too. But I usually like to use a product called Trifortify Orange or Trifortify Watermelon. That's a liposomal microscopically wrapped in fat variety of glutathione. Wrapping it in fat helps increase its absorption. And I would do 5 milliliters 1 time a day of that. Also, if you do not have red meat at least once a week, I would take acetyl L-carnitine. Carnitine is a chemical found in red meat that is used by mitochondria to carry fat to the inside where it's burned through chemical reactions into cell fuel. If you don't have adequate red meat intake, you're going to need carnitine. So I usually recommend something called acetyl L-carnitine, 500 milligrams twice a day for 1 month, and then decrease it to 1 time a day. All right. So those steps are how you repair nerve damage. They will work whether it's whole fiber or the membrane, any form. That's how you're going to repair it. All right. If you need more information about that, let me just do a quick screen share here so I can show you that article. Oops. All right, let's see here. Let me do a screen share. All right. And there's a chapter I have called Brain and Nerves. Trying to get there right now. Okay. And so to do nerve injury repair, take a look at this article called Neuropathy Repair, Heal That Tingling, Numbness, and Pain. Okay. The recommendations that I was just telling you are all written out in this article too. All right. Let me go back here again. Question, Charlie. I think there was a second part, but I'm just not seeing it right now. Hello, Deborah. Let's see. Hi, Doc. I was doing well, so I thought I would start decreasing slowly the Houtunia and Sida acuta. I also got the Pneumovax shot to check immunity. I have small fiber neuropathy bilaterally feet, which are now worse, and a new paresthesia on my right hip, which burns and is numb. I also take Banderol. Let me see if I can find the second part of your question there. Let's see. I also take Banderol Cemento, to which I am not decreasing. Any ideas what is happening? Do the antimicrobials also have anti-inflammatory effects, or is the infection back? What to do? Thanks. All right. I have to go back and re-look here again. All right. So let's see. I was doing well, so I thought I would start decreasing slowly the Houtunia and Sida acuta. Okay. All right. So a couple of things here. So it sounds like you've got neuropathy that's worsening, if I'm hearing your question right. You have neuropathy, nerve injury symptoms that are worsening as you've been decreasing your Bartonella treatment with the Houtunia and the Sida acuta. And that somewhere in here, you also got a Pneumovax shot, okay? So there's two things that I think might be going on, all right? One is the Pneumovax, whenever you get vaccines in Lyme, they sometimes can trigger a worsening of Lyme symptoms. Why that happens, we don't fully know, but maybe this is a reaction to having just gotten the Pneumovax vaccine. All right. The other thing is it is possible that the Sida acuta and the Houtunia were doing a good job at partially controlling your Bartonella, but that they didn't wipe it out all the way. So a clue of that is as you stop an antibiotic that was treating Bartonella, usually within about 2 to 3 weeks, the BART symptoms start coming back. And the reason they come back so quickly is Bartonella replicates pretty quickly, actually. About every 24 hours, each Bartonella germ in you will replicate. Therefore, it grows back fast. Therefore, you can get a rapid return of Bartonella symptoms, all right? So if there were other Bartonella symptoms you had at the beginning, go back and relook at those. And if those are also coming back, I would think Bartonella was not adequately treated with the Sida acuta and the Houtunia. In which case, again, I only find they work 75% of the time. You might want to look at my prescription antibiotic options for that. Okay? All right. Yeah, those are just some general comments. I am hoping I'm understanding what the nature of your question was adequately there, Deborah. All right? All right. Good luck to you. The other thing too, I don't know how permanent your neuropathy is, whether it truly was just a recent thing as you've come down on the Sida acuta and the Houtunia. But if it has been more of a long-standing thing, take a look at the recommendations I was just talking about for how to repair nerve damage. All right. And then one last thing point I'd make about your question. You raised the question: could antibiotics be anti-inflammatory? In other words, could you have worsening of symptoms because you're losing the anti-inflammatory effect of the antibiotic, the herbal antibiotics here? The answer is yeah. Antibiotics, especially prescription antibiotics, do have anti-inflammatory effects. The Sida and Houtunia herbal antibiotics may have anti-inflammatory effect too. So it's possible you're losing that, but I would err more on the side of this being a reaction to either the Pneumovax or to the Houtunia and Sida not working to get rid of your Bartonella. Therefore, it's coming back. Okay? All right. Thank you for that question, Deborah. Good luck to you. All right. Hello, Rita. Let's see. Starting BART treatment with clarithromycin for 1 month, then adding in rifampin for 3 to 6 more months. Does it make sense to use Hutunia and Sida at the same time? Um, I don't, let's see, at the same time, I don't know what ABD means. Do a year of antibiotics. I assume yeast treatment should be done now as well as before I get further out of hand. Thanks, Dr. Friadu. All right, so Rita, about the Bartonella question. So clarithromycin and rifampin together is a good Bartonella treatment. I find that it works about 85% of the time. And because of that, I don't think you need to add a Sida acuta and a Hotunia to it. Now, I will do that sometimes, but I'm usually only going to do it if I've got a person that is a Bartonella relapser. I usually find that using the clarithromycin rifampin combination, those two together at the same time for 4 to 6 months will be an adequate BART treatment 95% of the time. Wipe it out completely 95% of the time. It won't come back again. But when you start getting into relapse issues, I usually will try a different combination. If I get into a relapse, again, there's some other prescription options I probably would use before the Sida and the Hotunia. But at times, I will use 3 and 4 items, drugs and plus herbs, 4 things total, at times to prevent relapse if I get somebody that has relapsed before. Okay. But you really don't need to do it for most situations. And when you do it, if you do 4 at once, remember you increase your toxicity situation as well too. Okay. All right. Good luck to you, Rita. Hello, Oscar. Let's see. Hi, Dr. Ross. I thought I was past Bartonella, but now I've stopped antibiotics. I've started having a lot of bladder symptoms, again, frequency, especially throughout the night, as well as some joint achiness. Perhaps I need to return to BART antibiotics, or can I add one with the herbs? Okay, so Oscar. So one thing you might want to do, because it's still possible, I would check your urine, just make sure this is not a bladder infection giving you increased urination. Okay. But Bartonella can give bladder issues, as many of you are aware of. It can give burning on urination, urinary frequency, and that it does that because it causes inflammation and irritation of the lining of the bladder. Okay, so that's called interstitial cystitis. That's how Bartonella gives bladder irritation. Bartonella sometimes can give joint pain too. So I suspect you may have some Bartonella. And as I was just explaining, if you've used something that may have controlled Bartonella but did not adequately get rid of it, usually within about 2 to 3 weeks, those symptoms will start coming back. And that's because Bartonella replicates every 24 hours. So you might look at a different combination. And one combination you could use would be the Hotunia and the Sida. Just realize that they only work 75% of the time. I don't know which antibiotics you were on for your Bartonella, but there are many options you have for antibiotics, and antibiotic combinations using usually about 2 at a time will work about 85% of the time. Okay, so go back and relook at some of those recommendations I have in the Kills Bartonella article. That gives you good ideas on the kind of ideas that I find helpful. All right. Good luck to you, Oscar. Hello, Kelly. Hi, Dr. Marty. Does Lyme or co-infections affect the spleen? Have been ill with Lyme for a few years and having pain over spleen area and my back in the same area. Thank you for any insights. Huge thanks. Appreciate it for the webinars. All right. You're welcome, Kelly. So, Kelly, babesia, because it infects red blood cells and the spleen is an area where red blood cells get cleaned, sometimes can lead to spleen pain. I've seen situations like that before. But also Lyme can sometimes just give you pain in that area that has nothing to do with the spleen too. Though if you're having a lot of pain in that area, your doctor should examine it to see if it's enlarged. And if it is enlarged, they might want to do an ultrasound to see about the size of the spleen to see if it really is getting too large. Okay. In terms of helping with the pain, you got to figure out which infections you have, whether it's Lyme or whether it's babesia. Without making that the point of this question, what I would do is I have an article in the Treat Lyme book about how to diagnose Lyme. I have an article in the Treat Lyme book about how to diagnose babesia. Take a look there if you're trying to figure out if those are one of the two infections you might have. And in terms of how to treat, I have many articles on that too in the Treat Lyme book as well too. But yeah, this could be part of Lyme. This could be part of babesia. If your spleen is enlarged, get an ultrasound to confirm that it really is. In other words, if your doctor checks on exam and finds that your spleen is enlarged, they should confirm it with some type of imaging studies as well. Okay? All right. Thanks for that question, Kelly. Hello, John. Let's see. Hi, Dr. Ross. I'm treating babesia with Malarone, azithromycin, and artemisinin. I feel like my body moves to the right and to the left on its own. I feel heavy and sometimes light. Would you say this is a symptom of babesia, or is it more of a Lyme symptom? So, babesia can give imbalance where you just feel like you almost need to hold on to a wall as you walk. I'm not sure if those words are the same as what you're describing as being my body moves to the right and to the left. If it is an imbalance, that might be part of what babesia is, but that sensation you're having also might be part of Lyme. It could be either way, frankly. Okay? All right. Good luck to you. Thank you for that question, John. Hello, Kathy. Hold on here, man. I gotta take a swig, everyone. Let's see. Hi, Kathy. So does CBD oil help right away, or do I have to take it 1 to 2 months before seeing any improvement? Does it help mold toxin illness things? Okay. So CBD, everyone, is a chemical that comes from marijuana plants, all right? And it's found in large quantities in the green part of the plant. So not the bud, not the thing that people smoke and use recreationally, but from the green leaves and the green stems, you get CBD. Now, CBD oil also can come from hemp, which usually is not as active and as good as CBD from marijuana. All right. So if you happen to be in a state that allows for medicinal marijuana, then I would go to your medicinal marijuana dispensaries and actually get true CBD oil and not order it on Amazon, which is CBD that comes from hemp and may not have the greatest quality or the greatest potency compared to what you can get from a plant, the marijuana plant. Okay. All right. In terms of CBD, it tends not to give you the high. It's THC that does. THC is what's found in the bud part of the plant. Although there is no such thing as CBD oil that doesn't have any THC in it, okay? So the recreational bud that people use in their butters or their brownies or they smoke is predominantly THC, but a little bit of that THC chemical also gets into the CBD oil as well when you do your extractions, okay? All right, now, CBD can help with a lot of the Lyme symptoms. It can help with your body pain. It can help with nausea. It can help with weight loss. It can help with a lot of things. On Petri dish experiments that were conducted by Dr. Ernie Murakami up in Canada, where he writes about these Petri dish experiments. Ernie Murakami is a Lyme doctor in Canada that lost his license for treating Lyme, but he's continued to do a lot of work in the area, a lot of great work, actually. He's probably done a great job of educating a lot of the physicians, naturopathic doctors, especially in Canada, to treat Lyme. And so he's done some great work up in Canada with that. But he's done some Petri dish experiments that show that CBD might even kill Lyme. I don't find it, because I'm in Washington State where we have a medical marijuana law, so I can use CBD. As I've used it for more symptom management of my Lyme disease patients, I have not found it that helpful as a germ killer, okay? So although some people may get benefit of using CBD as a germ killer, on average, I don't find it gives you much benefit as a germ killer, all right? In terms of its effect on your symptoms, usually within a dose or two, you should know if the CBD is going to help with your symptoms. And if not, you may need to take more, all right? So with CBD, you just have to slowly increase the amount that you take until you find a dose that starts to help your symptoms. And helping your symptoms, like your pain, for instance, or your nausea, for instance, that should happen pretty quickly. You're not going to have to wait 1 to 2 months to see if that's going to give you help. If you're asking as a germ killer, do you need to wait 1 to 2 months? Yeah, probably so. But again, I don't find it to be that useful as a germ killer, all right? I don't think that CBD would help in mold toxin illness, which is an issue. Well, actually, it could help with the symptoms of mold toxin illness, but it's not going to help remove the toxins from you. And to remove the toxins that are triggering most of the problems in mold toxin illness, you would need to use binders to do that. Okay? All right. So for all of you that are wondering, what the heck is he talking about, mold toxin illness and binders? I'm not going to go into it right now, but I will show you an article that you can take a look at. Let me go ahead and do a screen share here again. This is an article that I have in the detoxification chapter called Mold and Lyme Toxin Illness, okay? This talks to you about various binders that you might try to pull mold toxins out of you if they are trapped in you. Keep in mind, if you've had mold exposures, about 25% of all people cannot remove mold toxins once they get trapped in you. And the only way to remove them is to bind them up in the intestines. And there are various binders that you can use to do that. This article talks about those binders and also just talks generally about what this thing is called mold toxin illness. Okay? All right. Let me go back here. All right, there we are. All right, good luck to you, Kathy. Thank you for that question. Hello, Jan. Let's see. Hi and good evening, Dr. Ross. I am finally getting the medical cannabis this month, and I'm wondering how to reduce the impact of getting off of OxyContin 10 milligrams. I have missed a pill, and it is miserable. I have been on this prescription for 2+ years. What can I do to reduce the withdrawal? Oh, boy. Jan, so when you stop narcotics, you can't just, if you stop them too quickly, you're going to go through withdrawal. Okay. One way to try to manage that is to not to decrease your total dose by more than 10% per day. All right. And I even tend to do slower tapers than that. I don't reduce, usually when I'm tapering somebody from narcotics, I'll reduce about 10% a dose each week. All right. So I reduce about weekly by 10%. If you're going more quickly than 10%, you might get into withdrawal symptoms. Withdrawal symptoms usually are going to be diarrhea, more cramping, confusion sometimes. If you are wanting to continue to reduce quickly, then you want to the way that you can help with some of the withdrawal symptoms is to use a high blood pressure medicine called clonidine. You'd have to talk to a prescribing doctor about how to use that. Usually you're going to start at about 0.1 milligram twice a day, but clonidine can help block some of the withdrawal side effects, okay? So my word of caution would be slow down how quickly you're coming off your OxyContin. Try not to drop your total daily dose by more than 10% each week and drop it only one time a week. And then you can use the clonidine, which blocks the adrenaline-like chemicals that your body is going to overproduce as part of withdrawal. It's an adrenaline blocker, and it's going to help limit some of those side effects. And I usually will start at 0.1 milligram twice a day. You can go higher than that if you need to as well, too. Okay? All right. And I don't have a good way to block the withdrawal from a natural medicine standpoint. All right. Good luck to you, Jan. Hello, Laura. Let's see. Hi, Dr. Ross. Can the joint cracking be helped by anything? Every time I move, I crack. Good question. So the joint popping and cracking is a symptom of Lyme. I have never seen a good explanation for what exactly it is. Like, why is it occurring? Okay. I think though that it has something to do with inflammation in the joints. The only thing I have found helpful is treat your Lyme, number one. Okay, that's the obvious one, of course. Secondly, I would try to decrease inflammation in the joints. And the way that I like to do that, as many of you know, my favorite anti-inflammatory to use in Lyme is to reduce inflammation chemicals called cytokines. Those cytokines are made by your white blood cells when they see Lyme germs, and they're made to turn the immune system on to better fight Lyme. However, your Lyme symptoms are actually excess cytokine symptoms, all right? And too many cytokines give you the symptoms of Lyme, like you can't think, maybe the cracking in the joints, low energy, fatigue, all that stuff. Lyme symptoms are really excess cytokine symptoms, all right? So my favorite way of reducing cytokines is to take the herb curcumin. Curcumin is a component of turmeric, the Indian seasoning turmeric. And I like to have people take 500 milligrams 3 times a day, up to 1,000 milligrams 3 times a day, okay? And you want to do your curcumin, if you get it, I prefer a microscopically wrapped and fat variety, and I use a Thorne product called Mariva 500, which is a form of curcumin that is microscopically wrapped in fat, okay? All right, but that's what I would suggest doing, okay? There are other ways of lowering cytokines too, and for instance, you can use quercetin. You can use something called FibroBoost, which is a brown seaweed called Ecolonia cava. If you are looking for other ways of lowering cytokines, let me just do a quick screen share here, and I'll show you that article. All right, so breaking Herxheimer reactions too, all right? Herxheimer reactions are cytokine excess syndromes, where as your immune system sees dead Lyme parts, it starts making too many cytokines, all right? So to look at what to do about your cytokines, look at the chapter called Herxheimer and Cytokines. And then here's my guide on how to control cytokines, all right? I talk about various herbal options. And actually, one of the simplest things you can do is get sleep. 7 to 9 hours of sleep helps lower cytokines as well too, okay? All right. So let me go back here. Hello, am alive. Histamine. Would you please describe the function of histamine and possible signs and symptoms? Okay. So there's starting to be, over the last year, there has been some interest in something called mast cell activation syndrome, all right, from which histamines are made. Okay, so let's talk about it real quickly. So there's a type of cell, immune cell in our bodies called mast cells. And historically, we have thought of mast cells as being cells that only had one function, and that is they made histamines in reaction to pollens and cat dander and other things we would be allergic that landed on them, okay? And so one approach to managing allergies has been ways to stabilize those mast cells so that they don't actually release their histamines. And there's prescription options and herbal options that you can do for that, right? More recently, in the last years, there's become a body of evidence that shows that those mast cells actually can get activated and turned on, not just by allergy things, but by infection. And there's the tie-in to Lyme, okay? So some people with chronic virus infections, chronic Lyme, other chronic infections, start developing a lot of allergic type reactions. So they get histamine, they get hives, they may start having a lot of rashes, they get runny nose, watery eyes, and they're not really allergic to the environment around them, but rather have just become really reactive even to a lot of medicines, for instance, all right? And what that could be due to is that their germs have overstimulated their mast cells, and those mast cells then release the histamines, okay? Now, there is testing you can do to see if you have mast cell activation syndrome, but those tests are really not reliable. And so you really have to decide if you have it based on what your symptoms are. So are you a person that has a lot of allergic reactions, a lot of hives, a lot of itching, a lot of food sensitivity. In that case, it might be that you have developed mast cell activation syndrome. And the ways to treat are herbally, to use an herb called quercetin. Quercetin is a plant that, a substance that comes from the skin of colorful fruits and vegetables. It stabilizes mast cells and causes them not to release histamines as easily. The dose you would want to do is 250 milligram pill, and you want to take it at least 2 of those 3 times a day. Herbally, also using something called luteolin, that's Luteolin, luteolin, and you want to do it as about 100 milligrams twice a day. I think that's the correct dose, but luteolin twice a day. Luteolin is also a very good mast cell stabilizer, and sometimes you use both together, okay? If that's not enough and you still continue to have a lot of like hives and runny nose and itching, food sensitivities, then the other things you can try would be prescription antihistamine medicines. And one thing you might try is something called Singulair, which we use in people with asthma, for instance. You might try other antihistamines like Claritin or Zyrtec. You might try those, okay? So sometimes we have to layer all of these approaches together to quiet those mast cells down. Ultimately, though, to treat the syndrome, you wind up having to kill the germs that are triggering it, okay? So your Lyme, for instance, okay? So the recent research has been interesting because we used to think of mast cells getting turned on just because of allergies, that they're reacting to things in the environment. That's not so. Sometimes they're getting turned on because of infection overly turning them on. Okay? All right. Thank you for that question. Hello, Eric. I say, hi, Dr. Ross. Do you treat with iron when a ferritin is low, 30, in a postmenopausal woman whose hair is falling out? My wife read that 40 to 60 is the optimum level. Any suggestions to taking iron in this situation? So ferritin, everyone, is the storage form of iron in our bodies, all right? And usually, so when people have hair loss, there's 2 metabolic conditions that you can correct that help. One is low thyroid, and the other is low iron. It appears that if you can get your ferritin so that it's 40 or higher, that it can make big differences on hair loss. And so the way to do that is with iron. The form of iron I like is a product actually made by Thorne called Ferrosorb. And the reason I like it is it's easily absorbed. Iron, and a lot of people gives constipation. The Ferrosorb tends not to. And a lot of people take anywhere from 2 to 3 pills 1 time a day. Okay, so that's an option for you to consider, Eric. But yeah, usually I will look at using iron if ferritin levels, if the storage form of iron levels are 40 or less. Okay, I'm sorry, 39 or less, not 40 or higher. Okay, thank you for that question. Hello, Randy. Let's see. Is there danger from mercury and fillings? So much controversy over this. Does mercury cause more problems in Lyme? Is there herbs or supplements that can reduce the toxicity of mercury? What's your take on this? All right. So mercury in your fillings in some can be toxic, but probably not in most. And so, for instance, there is a physician out here named Dietrich Klinghardt, who many of you may be familiar with, who recommends that people get their mercury fillings out before he'll even treat them. And I totally disagree. I think that for some people, heavy metal toxicity is the thing that's going to block their treatment. But in the majority of people, even when we have mercury fillings, the amount of mercury elevation that occurs in us is minimal and does not impact how you're going to do. All right. So let me talk about heavy metals here for a minute. So heavy metals are things like lead and mercury, all right? And if we get too many heavy metals, not in our teeth, but actually absorbed in us, all right? And the way they're going to get from our teeth to us is that as we chew, our mercury fillings will have a small gas vapor that forms over them. They off gas. we breathe and swallow that mercury vapor in, and then it eventually gets absorbed into our bloodstream. That's how you're going to get it from your fillings. It's not going from your fillings directly into the blood supply of the tooth. Okay, that's not how it's happening. It's happening from the mercury vapor. All right. Now, your fillings that are older tend to off-gas easier than new fillings. All right. All right. Now, in terms of Lyme, I'm confusing a few things here. Just let me keep down one line of thought, and then I'll go to the other line of thought. All right. So what happens with mercury when any heavy metals get in you, when we breathe them in, drink them in, the majority get into our bloodstream, and the majority of them get peed out by our kidneys. They get filtered out. The problem is in the amount that gets stored in us, though. And some of the heavy metals actually do get stored in us. And where they get stored is on the inside of our cells. Inside of our cells, they are drawn to sulfur. And what is rich in sulfur are the energy factories found in every one of our cells called mitochondria. I talked about those earlier tonight. Mitochondria are what our cells use to generate energy. There's 300 to 400 per cell. And inside mitochondria, sugar and fat are burned through a bunch of chemical reactions into cell fuel. All right. Those chemical reactions all have enzymes that cause them to happen. And those enzymes are all rich in sulfur. So guess where these heavy metals go when they get inside your cells? They go and they bind the sulfur on those enzymes. And if there's too much binding of the sulfur on those enzymes, they're not going to drive the chemical reactions that create energy. So therefore, you're going to have inadequate cell energy. All right. Now, heavy metals, once they get in you, have an elimination half-life, the amount of time it takes for half to get out of you, of about 23 to 24 years. Right? That's a long time. And so therefore, you can have a bunch of small exposures over a lifetime that gradually build up inside of your cells and cause a problem. All right. So the first step to figure out if you have a heavy metal toxicity problem is to do a study to see if you've got too much in your cells. And the way you study to see if you have too much in your cells is to take a chelation agent, something like a metal magnet, either a pill or through IV injection, and then collect urine for 6 hours after you take those pills, and then see if it comes back elevated from the lab. The lab that I like to use that does that testing is called Doctor's Data. The substance I like to use is a pill called DMSA that I dose based upon how much a person weighs. And I do this chelation challenge urine test to see, do they have too many heavy metals? Okay. Now, when you get back a report, what I have found is that you need big elevations above normal, not small elevations, but big elevations are the ones that impact health. All right. So for instance, normal mercury level for most people is going to be 2 or less. Or is that lead? I think that's actually lead. Lead is going to be 2 or less. And I like to keep my levels so that they're about 12 or less. I usually don't find much benefit for chelating from 2 to 12. I don't find people get any improvements in their health. Okay. All right. So first of all, before you start yanking out your fillings, is to find out, do they really cause you a problem? Okay. All right. Then there's another thing I want to say. And that is in Lyme disease, there are many things that impact your health. Okay. There's the effect of the germs. There's whether you're getting too many yeast in your intestines. There's the cytokines that cause you to have most of the symptoms. Those cytokines make it so your hormonal systems don't work. But there's a lot of different things that impact your health. Of those, heavy metal toxicity tends to be lower on the list of problems. All right. To get over Lyme, you do not need to fix every problem. You just need to fix enough of the big problems so that the ship starts working correctly. Okay. So heavy metals is something I do not go after right away. I will start wondering about heavy metal toxicity being the major problem for my patients if I've done the standard things I do to manage Lyme and they're not getting better by 6 to 9 months. Then I might start looking at heavy metal toxicity. Okay. Now, the only exception to that rule is if I've got somebody that comes in with a history or I know they've got a lot of heavy metal exposures, and that's not from the fillings in your teeth. Okay. These would be people that are artists that work with paints that are impregnated with lead or other heavy metals, okay? Or these would be people that use a lot of fishing lures that have lead in them and they rub their fingers over those lead all the time. These would be people that handle lead a lot, like people that make stained glass windows. Or these might be people that live next door to a factory where there has a lot of gas going up in the air that have heavy metal toxicities, okay? But lead or mercury from your fillings is actually, in most people, there is an extra small percentage that gets absorbed. And in most people, it is not a problem. All right. So I disagree with my colleague, Dr. Klinghardt out here, who basically almost requires everyone to get their teeth extracted, all their, I'm sorry, not their teeth extracted, but to have their heavy metals all removed before he'll touch them. I totally disagree with that. In fact, I get people well all the time without doing anything about their heavy metals. I would say maybe about 2 or 3% of the time I have to do some chelation work with my patients to deal with a heavy metal toxicity problem. Okay? All right. Yeah. I know what I wanted to show you. So let me show you the standard steps that are the important ones to take in a Lyme disease treatment at the beginning, especially. All right, as I said, you don't have to fix every problem. You just got to fix the right ones early on. We don't have to fix everything to get somebody healthy. Lyme disease is what is called a total load phenomenon illness, where there's many things that contribute. You only need to fix the right things, okay? And so here's what I have found. So I'm going to do a quick screen share, and I'm going to show you the things I focus on initially at the beginning of a treatment. Figure out what those are. Take a look at my treatment protocol page in the Treat Lyme book. Okay. And what I find to be the most helpful is get sleep. The reason you want to get sleep is it restores the function of your immune system. It helps you deal with pain better, but it also lowers cytokines. Okay. And I tell you the steps to take to do that here. Number 2, I like people to try a paleo type diet, and I describe that here. Number 3, lower those cytokines that I keep talking about tonight. And the way to do that is with curcumin. Number 4, be on an herb that helps your body deal with stress and adapt to it. Those are called adaptogens. My favorite one is the herb called ashwagandha. Number 5, figure out if you have low hormones or even subclinical low thyroid like I was talking about earlier. And if you do, then go ahead and correct those. I tell you about how to do that here. And I even tell you about how to figure out if you have those problems clinically, okay? Be on a good multivitamin. Number 7, see if you have too many yeast, and if you do, get rid of them. And I talked to you about how to figure that out here. Number 8, treat your Lyme infection. And I give you options here. Number 9, do some basic detox steps, and I talk about those here. Number 10, treat your co-infections if you have them. Figure out if you have them and treat them. All right. Number 12, do exercise. Okay. And then you notice part 13 is the things you should do at 6 months and beyond if you're not getting better. Okay. And in this list is my detoxification treatments at about 6 months and beyond. If you're not getting better, that's when I'd start looking for heavy metals, okay? I don't do it right away because I find such low chances of improvement by fixing those problems, okay? So I generally would not recommend getting your fillings out right away, all right? All right, so let me go back here. Hey, I'm not a big believer in going after heavy metals right away. I think you probably got that, all right? Good luck to you. Let's see here. Hello, Catherine. Let's see. I feel awful after taking glutathione. Symptoms like brain fog, burning muscles are a lot worse. I lack certain detox genes. I've read taking glutathione can therefore be like pouring more toxins down a blocked drain. What could I do instead? Take precursors? So, Catherine, a few things, and I guess I would need to ask you a lot more questions to help get under this. But these are just some general comments without knowing enough about you and your health in general, okay? But you could raise glutathione in your cells by taking the precursors. and that would be to take something called N-acetylcysteine, also called NAC, 500 milligrams 3 times a day. And I also like taking alpha lipoic acid, anywhere from 200 milligrams 3 times a day to 350 milligrams twice a day. If you do those two things, those are your building blocks. They're going to help raise glutathione in your cells, okay? But there may be another problem happening here. If you have had blocked detox pathways and then you suddenly start detoxing with glutathione, it can flare you up, just like you described there, all right? And so think of it as like a big roadblock here, and you've had a shortage of glutathione, right? You got the roadblock here. Now you take glutathione, that roadblock moves aside. Guess what starts flooding through? All of those toxins, okay? And what those toxins do then is they flare cytokines. They increase those cytokines that I've described tonight, all right? So you might want to start at a really reduced dose, like maybe a quarter teaspoon of the glutathione, and be sure you're on a cytokine blocker like curcumin, 500 milligrams 3 times a day to see if you can do it, okay? Or the other idea, like you mentioned here, is to do alpha lipoic acid along with the N-acetylcysteine would be an option for you as well, too. All right? All right. Good luck to you, Catherine. Thank you for that question. Hello, CJ. Let's see. I've been diagnosed with Funneliformis rosaceae. I can't find much information about it. Can you tell me something about it, especially treatment options? Thank you. No, I cannot. This is not a condition I know off the top of my head. You could even see as I was stumbling and trying to figure out how to even pronounce it. I'm sorry, CJ. I don't know anything about this one. This is something I would have to look up before I could give some guidance on it. Okay? All right. Good luck to you. All right. Hold on here just a minute before I take Renee's question. Let's see. We communicated. Hi, Renee. We communicated by email in 2014. I had my plasmapheresis done at Swedish hospital for 3 years, once a month. I still have residual of tingling and my tongue and hands and feet and fatigue that I am much better. I've had Lyme disease since 2001, so I do feel I have co-infections. I'm taking Cob to Kai. Let me see if I can find a second part to this. I'm taking CoQ10 and the vitamins and C and cook. Renee, I don't see the rest of your question here, unfortunately. So I'm sorry I can't answer this. I just can't see where the rest of it is. Oh, I think I just answered that one. Looks like you posted that one twice, Catherine. Let me get rid of that. Hello, Adrian. Let's see. I was in Nova Scotia in April, and I found a tick on my neck 2 days after I walked down to the beach. Tested for rickettsia May 9th. Results May 25th. Evidence of infection at an undetermined time. Waiting results for second test. What antibiotic tinctures for rickettsia? So presumably, I haven't used the Banderol Cemento for rickettsia before, but rickettsia should respond to the same things that we do for Lyme. I would look at probably a Banderol Cemento. I think my preferred option would be if you can get somebody to actually just start giving you doxycycline while they wait for final testing to come back. I think that's the preferred option. And for the rickettsia, I would do 100 milligrams twice a day. And I would even look at doing that for 3 to 4 weeks. Okay? All right, Adrian. Good luck to you. Hello, Faye. Hi, Dr. Ross. I have recently been diagnosed with Lyme. I have had numbness and tingling in my hands and feet for 15 years. diagnosed with idiopathic sensory peripheral neuropathy. I also have hair loss and sweats day and night, along with other symptoms. I'm thinking it's Bartonella. Let's see. I have not started any treatment for anything yet, and I'm quite high functioning. I eat a good diet and take lots of antioxidants. If I treat the Bartonella, will that wake up the Lyme more and make things worse? What do you suggest? Thank you. All right. So, Faye, this is one situation. I'm going to give you a response, but this is one where you may, for me to give you the best, I need to ask you lots of questions. And unfortunately, I can't ask you lots of questions in this format. I do have the ability to consult with you online. It's an online consult where I schedule half-hour to 1-hour visits with you, and we can talk over the internet, and I could come up with a more precise answer for you, okay? But two things I want to point out. So neuropathy, yes, can be due to Bartonella. But before saying it's necessarily Bartonella, I would want to know if you have any other symptoms suggesting Bartonella. So neuropathy by itself does not mean Bartonella, but can be part of Bartonella. And so other things I would consider is, do you have pain on the soles of your feet, any ongoing problems with anxiety or depression, bladder issues, restless leg syndrome, neurologic hypersensitivities like sound, touch, or light sensitivity? Do you have a lot of tremors? Do you have difficulty with thinking? There's a whole host of questions I would want to ask to figure that out. There's something else, though, that caught my attention in what you wrote, and I wonder about babesia being part of your problem, too. The night sweats that you get could be part of babesia. Hair loss also sometimes can be part of babesia, too. And so I would want to ask a lot of questions about figuring out if you have babesia as part of this, too. And then there always is the question of how much of this is Lyme. So it gets to be kind of tricky to figure this all out. So I'd suggest you take a look at the consult service that I have so I can give you the best advice, okay? So let me just do a quick screen share here again. Book on my navigation menu up here is this tab called Online Consult, okay? Anyone can use this actually, okay? So feel free, read through all of this, okay? So read everything about how it works and see if this is something that might work for you. Just be aware that by doing this online consult, I cannot prescribe or order tests for you. I do write up a doctor's visit note, though, that you can then share with your practitioners, see if they would implement some of the things. But I can help at least answer your question as to what this is, okay? Keep in mind, Bartonella and babesia are usually, I diagnose clinically. I don't diagnose based on testing. The reason for that is the Bartonella, we estimate 30 strains. We can only test adequately for 2. Babesia, we estimate 15 to 20 strains. We can only adequately test for 2 also. So in making decisions to treat those co-infections, usually I'm going to look at or enough symptoms saying Bartonella to decide if those are things that you might want to treat too. Okay? All right. And then Faye, one other thing I would say, just, and this is something we would tease out if we do talk, is if you have good energy, but you are more just having neuropathy, it is true. It may indicate that even though you tested for Lyme, that Lyme is not your major problem, but rather the co-infections, okay? So generally, when people have active Lyme, they are going to also have low energy as part of it being active, generally, okay? All right. Good luck to you. Thank you for that question tonight. And good luck to you with your new diagnosis and treatment too. Hello, Barbara. Let's see. Hi. Hello, I'm Barbara. My daughter was tested for Lyme and has Mycoplasma pneumoniae infection. She was treated with minocycline 2 tabs per day and had a bad reaction, including vertigo, joint pain. She stopped it for 2. Now now should she go on it again? Okay, so a few things. First of all, minocycline is an antibiotic. It's a tetracycline, and it's a very fat-soluble antibiotic, meaning it gets into fatty tissues easily. One of the reasons I like working with it is because it is fat soluble. It gets into the brain. All right. So there's our brain has a layer of protection that keeps things out, toxins out, antibiotics out, and that's called the blood-brain barrier. And things that tend to be fat soluble tend to cross into the blood-brain barrier more easily. Okay. Now, that doesn't mean that things that aren't fat soluble don't get in. So, for instance, the prescription antibiotic Biaxin, which is generally not to be thought to be that fat soluble, actually does a great job in my clinical experience treating Lyme, Lyme in the brain. Okay. And I do use it for that, even though the labs would say clinically it doesn't cross the brain, it still can get in there adequately. All right. So, being a fat soluble antibiotic, the minocycline sometimes concentrates so heavily around the nerves in the brain that it irritates them. And one of the side effect symptoms can be the vertigo and the dizziness you described. All right. So because of the vertigo, I don't think the minocycline is a good antibiotic for her. The joint pain could have gotten worse because it was killing Lyme germs in the joints. All right. And that's called a Herxheimer reaction. To manage the Herxheimer reaction, use the curcumin that I've mentioned a number of times tonight, 500 milligrams 3 times a day, or you could even increase that up to 1,000 milligrams 3 times a day. If you're going to give the curcumin a try, use a quality product, okay? So I would use a product made by Thorne called Mariva 500. I can show that to you here in a second so you know what I'm talking about, all right? Now, about the Mycoplasma pneumoniae. Although it does show up in a lot of people's tests, I don't usually go after it. But anything you do to treat the Lyme germ that lives in your cells. So Lyme exists in 3 forms. It lives as a spirochete, which is the corkscrew-looking thing you've seen pictures of on the internet. Another form that it lives in you is inside of cells called intracellular Lyme. And then there's a third form, which is a microscopic cyst form of the germ, okay? Anything we give you to treat intracellular Lyme, like minocycline, for instance. Minocycline also treats spirochete Lyme too. But anything we give you to treat intracellular Lyme treats mycoplasma too, all right? But I don't think we should, I'm not a believer in treating mycoplasma because if you pull 100 healthy people off the street, these are people that are healthy. These are people that have no health problems at all. You will find laboratory evidence in about 10% or more of having elevated antibodies against mycoplasma, all right? So mycoplasma lives in healthy people. And it doesn't cause problems because our immune system probably keeps it under control. All right. The way that I like to approach mycoplasma, if I get somebody that has it, is I treat their Lyme. And I do all those other things I showed you earlier tonight in my treatment protocol about how to treat Lyme, because all those things boost the immune system so that it puts the mycoplasma back under control if suddenly the immune system is not doing that. Okay. So your approach to getting rid of mycoplasma is to follow the successful treatment recipe I mentioned earlier tonight and treat the Lyme, okay? All right, now, what could you use instead of minocycline because she's got the side effects? Well, you could do doxycycline. It's not as fat soluble, therefore you tend not to get the vertigo with it. Keep in mind, though, that doxycycline in the summertime tends to lead to more sunburning more easily than minocycline does. Another antibiotic you could use instead would be Biaxin. That's a 500 milligram pill twice a day. It's in the family of erythromycins, or we call those the macrolides. Zithromax is in that family too. Biaxin works more strongly though, okay? 500 milligrams twice a day. Now, I have one concern, and maybe you just don't know what else your daughter is on. You want to make sure that if you're treating Lyme, that you also are treating the cyst form of the germ. All right. Biaxin will treat intracellular Lyme. Biaxin is also going to treat spirochete Lyme, but it does nothing for the cyst form. A simple way to add coverage or an antibiotic to treat the cyst is an herbal antibiotic called grapefruit seed extract, 250 milligram pill that you take twice a day. Okay? All right? So I don't think I would try the minocycline again. I think I would try a different antibiotic. I wouldn't so much focus on the mycoplasma. Basically, what you do to deal with Lyme is going to take care of that. And then I would consider doing Biaxin and grapefruit seed extract. Okay? All right. Let me just do a quick screen share here for you. What actual products I recommend. This is my supplement store called Marty Ross MD Supplements, okay? And this is where my patients get their supplements. This is where people across the country that aren't even my patients get their supplements. And so these are ones that I have found to be effective in Lyme, or as part of a Lyme disease regimen. All right. And I choose these products based upon products that I think have looked at and seen to do the best job of finding the most active ingredients. Okay. Yes, you can find lower cost stuff, but keep in mind low cost supplements tend to put garbage in that doesn't work. In fact, there's been numerous independent studies where independent groups have gone in, pulled supplements off the shelves at supplement stores of lesser quality products and found that what they say is in them are not in them. All right. So you want to make sure you're working with products that have been shown to actually have the active ingredients in them when they say they're in them. And also use supplement companies that don't even just put the active ingredient in, but they tend to put the ones in that have the greatest chance of working. Okay. Secondly, I choose supplements that don't have a lot of artificial fillers in that could hurt you. All right. So if you're looking at what do I recommend, look here, you can see the manufacturers I use. This is my drop-down list. These are ones I find to be high-quality companies, okay? So, for instance, if you want to see what it is I have that has curcumin in it, if you're looking for product ideas, just type in curcumin up here. And curcumin comes in a variety of products that I actually have, but the one that is just curcumin by itself is the Mariva 500, okay? That's the Thorne product that I was telling you about earlier tonight. All right. All right. Let me get out of here. And good luck. Good luck to your daughter, that is, too. Hi, Jenny. I answered this question earlier. Another person that wrote about CBD, which is cannabis. I would use the CBD oil and not the THC. But if you happen to have missed that, listen to the recording tomorrow. I'm not going to go back over it again. All right. Hello, Casey. Hi, Dr. Ross. Do you find that eye issues, blurry vision, inflammation, floaters, fuzzy vision, disorientation, overstimulation, etc., is more commonly caused by Lyme or Bartonella? Assuming there are other symptoms that point to Bartonella as well. The floaters I find to be more Lyme. They're due to inflammation. Blurry vision, fuzzy, disorientation, overstimulation could be Lyme or Bartonella. That's kind of how I break it down. Okay. All right. Good luck to you, Casey. Hello, Christy. Hi, Dr. Marty. Hello. I was diagnosed with central sensitization and trigeminal neuralgia 2 years prior to my Lyme. Epstein-Barr, mycoplasma, chlamydia. Is it possible that the neurologist's diagnosis is actually symptoms of Bartonella? I cannot tolerate any cool air, air conditioning, draft fans. There's a second part here. Let me see if I can find it. Let's see. My nerves are intensely triggered by any airflow. It only occurs on my left side, primarily with all the nerves on my face, scalp, then pain behind the eye and deep in my ear. I was never diagnosed with Bartonella. Take NT and glutathione, no change yet. The pain is it. I think I want to see if there's another part here. Just a minute. All right. So Christy, I'll put up the beginning part of your question here. So the central sensitization and trigeminal neuralgia. Central sensitization means her brain has now been changed in a way that it causes the pain. Okay, can be caused by Bartonella or can be caused by Lyme, and I would consider treating for both. And yes, I would do the nerve repair ideas that I have, the NT factor, the glutathione. Don't forget to do coenzyme Q10. That's part of my protocol too. 400 milligrams 2 times a day on that. Okay. And I talked about that whole protocol earlier tonight too. All right. Good luck to you. Hello, B. Let's see. I know ciprofloxacin can be taken with doxycycline. Can clindamycin be taken with doxycycline? Clindamycin 300 milligrams 3 times a day and doxycycline 100 milligrams twice a day. Trying to cover myself until an appointment with new doc since losing my previous doc. So the answer is yes, you can take clindamycin along with doxycycline. So the clindamycin is going to treat spirochete Lyme. It's known as a cell wall agent. And what it's going to do is it makes it so that the covering of the spirochete cannot repair itself as it gets injured. Eventually, the germ develops holes in its covering, and as it grows, it bursts. Okay, that's the theory of how it works. The doxycycline is going to treat intracellular Lyme and also the spirochete form of the germ by blocking protein production of the germ, so the germ has a hard time growing and also repairing from the inside then, okay? And yes, you can couple both of those together. There's no problem in doing that, all right? All right. Good luck to you. Oh, I don't forget to treat for your cyst form of the germ, though. If you're doing this, you've got your cyst uncovered, and the problem is that the germ could have a tendency to convert from spirochete and intracellular into the cyst form. As those forms get stressed, some of those are going to jump into the cyst form, all right? So look at the grapefruit seed extract that I mentioned earlier tonight, 250 milligrams 2 times a day on that, okay? All right. Good luck to you. Thank you for that question. Hello, Maya. Let's see. Hi, Dr. Ross. I've been taking oral antibiotics for about 3 years now and on month 2 of a PICC line. My insurance is no longer covering my PICC line treatment, and it's too expensive for me to continue out of pocket pay for it. How long do you feel a PICC line treatment needs to be effective? So Maya, generally, I am going to wind up using a PICC line. If I'm going to go there and I'm going to do IV antibiotics, I am going to wind up giving it at least 6 months of a trial before I decide it's not going to be effective, okay? That's generally what I will do, all right? The other thing you should be aware is even if your insurance is not paying for it, there are ways of making it more affordable, and that is to have a family member trained to do your PICC line dressing changes so that you don't have to rely upon nursing to do that. And then also there are places you can order the ceftriaxone if that's the antibiotic you're using. That can be gotten for around $400 or so a month. There are places that you can get it that way, so you can reduce your costs down and do it more as a do-it-yourself as opposed to having a nursing services helping you, okay? All right. And if you happen to be a Maya that is my patient, which I can't tell from your last name, but I do have a Maya that we recently put on a PICC line. If you're not doing well, because the last time we talked you were, get a hold of me. I'd like to talk with you about that, all right? Okay. Good luck to you, Maya. Oh, I see we answered that earlier. All right. Hi, Dr. Ross. I had a stool evaluation that showed that I'm not digesting fat. My doc recommended ox bile, but how do I get my liver and gallbladder to work properly instead of just replacing bile? So, Deborah, I guess I need to know a lot of things, but one of an idea I'll just raise with you is sometimes your pancreas, which is supposed to make enzymes that um, break down fats, which would be something called amylase, something called lipase. Those are enzymes that break down fat. Sometimes the pancreas doesn't work well enough to make those. Okay, all right. But the other thing that can happen is if you have yeast overgrowth too. Yeast, healthy bacteria in your intestines are also involved in helping with digestion of fats, proteins, and sugar. And if you have too many yeast in your intestines, they're going to have pushed out the good bacteria, and therefore you don't have enough good bacteria aiding your digestion as well too. So one thing you ought to consider is, do you have too many yeast? Okay, that would be one thing I'd take a look at. There's an article that I have written about how do you figure out if you have too many yeast. Let me go ahead and show that to you here. in the chapters, there's a chapter I have on yeast. Okay. Take a look here. You'll find information about how to treat and how do you diagnose. Okay. But if you have too many yeast, you want to treat those so that you can get better digestion of your fats. All right. The other thing you can use instead of ox bile is to take digestive enzymes. And there's a product that I use called Similase, which has your proteases, your amylase, your lipases, basically your enzymes that will help break down food as well too. Okay. And if you do the Similase, it would be 2 pills before meals 3 times a day. I generally think you probably have more of a yeast problem here. That's what I find the issue is. All right. It's not so much that the liver and gallbladder aren't working, making their enzymes. It's just that you're not getting the help of the healthy bacteria in your intestinal lining to help with the digestion. Okay. Right. Good luck to you. And thank you for that question. Hello, Sue Ann. Let's see. Good evening, Dr. Ross. I've been treating Lyme Bartonella for 6 months, and my original symptoms are dissipating. But 2 months ago, I developed a new symptom. Voila. I have gnawing pain in the muscle of my right bicep. It is especially painful when I reach to pick something up. Is there anything that I could do to help remedy this? And actually, there's a third part to your question. Thank you so much for your help and advice. All right. So, Sue-Ann, this is a question for you that I would ask if you were here, and I know you can't tell me the response, okay? So if this is the only area where you have developed muscle pain and all of your other body pains have generally been getting better, one thing you might want to consider is that this is not Lyme related. All right, now I'm just going to throw that idea out, okay? So one thing we have to be careful about when we have Lyme disease, and even I as a physician have to be careful about, is to not put my Lyme blinders on and only see everything as Lyme. People get other things too, okay? And it's possible, maybe through daily activities, that you have strained your muscle and your biceps. So sometimes what I will do when I've got a person that's developed an isolated area of pain, and yet it looks like on the whole, all of their other Lyme symptoms are getting better, what I will do for that is I will send them to physical therapy to see if physical therapy can help. And often that is what will help, okay? So those are some things I would consider doing, okay? The other thing you might consider is some magnesium to help deal with the muscle cramping in that area. I'm doubtful that you're dealing with just isolated magnesium deficiency in that muscle. The fact that it is only one place, at least that I can gather from the description here, suggests to me more of a muscle strain injury or weakness that needs to be fixed with physical therapy. Okay? All right. Good luck to you, Sue-Ann. All right. Let's see. All right, let's see here. What time are we at? All right, I'll take one other quick question. Let's see. What do you think of DNA Connections? So DNA Connections, everyone, is a lab that is doing PCR DNA testing of urine for Lyme and the co-infections. I don't like them. The reason I don't like them is they haven't done the legwork that they should have done. They haven't done the type of testing where they go out and prove that their test actually works. It's called validation studies, where you take your test and you find people that are known for sure to have an illness, and you see how accurate your test is at correctly identifying them. My sense with DNA Connections, because I have a number of people coming to see me with their tests from other practitioners, is that they are reporting a number of Bartonella positives and babesia positives that I see absolutely no evidence of those infections clinically in my patients. And therefore, I think their testing for those co-infections is overestimating. And we should not get trapped in medicine to treat just a test. We have to say, does it make sense? All right. So you can have false positive tests. And I suspect that their ability on their babesia and their Bartonella is creating a lot of false positive tests. But I don't know, because they haven't gone out and done the type of basic work that any decent lab should do, which is to do testing to show that their test is valid. They haven't done those studies, okay? All right, so that's my thoughts on DNA connections, all right? Thanks for that question. All right, everyone, that's it for me tonight. Listen, tomorrow morning you'll get an email from me somewhere between 6 and 6:30 Seattle time. At least that's if everything goes as planned. I have to edit the video tonight and have those edits stick overnight, and I'll get an email out to you tomorrow morning. In that email will be a link that you can go ahead and click to watch the video. Also in that email will be a link to sign up for next week, okay? But if you cannot wait to sign up for next week, here in a second, I'm going to redirect you over to the treatlyme.net, and you can go to the webinars page there and sign up for next week now, okay? The other thing you can do on that site is subscribe to the Treat Lyme book. And you can subscribe by clicking on an article that interests you. And if you are not a subscriber, you're going to be asked to subscribe. And when you subscribe, just keep in mind you support this kind of work, this forum that many people get help from, okay? All right? So good night, everyone. Good seeing you. I look forward to seeing you next week. Bye-bye.